As from your clinical experience, would you think that if this kind of thing were legal, that it would be helpful to patients who are terminally
Oh,
ill?
oh, we are just beginning to look at the therapeutic impact
Mm,
of all the
right.
psychedelics. The subtitle of my book is New Hope for Depression, Addiction, PTSD, and Anxiety.
Right.
And there are groups of Vietnam veterans, well, all the veterans, but some of these older veterans from Vietnam who have been suffering for decades are going down to Peru and working with shamans to get relief
Mhm.
from the trauma. So we're just beginning to tap into how healing these medicines are. When my focus in the research I did was always, well, what happens after the ceremony? I mean, there are a lot of the descriptions of the experience of the ceremony are very dramatic and exciting. But as a clinician, I want to know, well, how has your life changed?
Yeah.
And people really did consistently report a reduction in depression and anxiety. Their sense of self improved. Um, they did their personal relationships improved. They did something that we as psychologists don't know how to get people to do, is they improved their health habits. So they began to eat healthier and exercise more.
Interesting.
We have struck out on that completely, the physicians too.
Yeah.
And so this emerges spontaneously from ceremonies. And also there's a shift in their philosophical worldview,
Mhm.
in that they have a much different sense about life after death and their relationship in the cosmos and their relationship to nature.
Mhm.
So
I would.
these are huge changes. And also I can add one more. I'm sorry, I can add one more that's really important that therapists don't really look at is people develop a clarification of their purpose in life. So they're inspired to do something.